Welcome to DoodleMed Insights.
Today, we will be discussing a very serious and potentially life-threatening condition known as infective endocarditis. Infective endocarditis is an inflammation of the inner lining of the heart, called the endocardium. This condition typically results from an infection, most commonly caused by bacteria entering the bloodstream and attaching to damaged areas of the heart. Infectious bacterial endocarditis is a serious condition characterized by bacterial infection of the cardiac valves, leading to the formation of vegetations on the valve leaflets. The inner lining of the heart becomes inflamed and infected, causing a variety of symptoms such as fever, chills, fatigue, unexplained weight loss, and a cardiac murmur. As the infection progresses, it can damage the heart valves and lead to complications such as heart failure, stroke, or even death if left untreated. So, how does one develop endocarditis? Well, there are a few risk factors to consider. People with pre-existing heart conditions such as valve abnormalities or congenital heart defects are at a higher risk. Intravenous drug users, individuals with a weakened immune system, and those with a history of dental procedures without proper antibiotic prophylaxis are also more susceptible to developing endocarditis. When it comes to the types of infective endocarditis, it has two main types, acute and subacute. The difference lies in the virulence of the organism involved. Acute endocarditis is typically caused by high-virulence organisms like Staphylococcus aureus, leading to large destructive vegetations and a poor prognosis with mortality rates ranging from 10 to 40%. On the other hand, subacute endocarditis is usually due to low-virulence organisms such as Streptococcus group viridans, resulting in a more indolent disease course with lower mortality rates. The diagnosis of endocarditis can be challenging, as the symptoms can mimic other conditions and vary from person to person. A thorough medical history, physical exam, blood tests, and imaging studies such as an echocardiogram are often needed to confirm the diagnosis. Physicians often rely on a set of criteria known as Duke's criteria. There are two major categories of Duke's criteria: the major criteria and the minor criteria. To meet the diagnosis of infective endocarditis, a patient must have either two major criteria, one major and three minor criteria, or 5 minor criteria. The major criteria include positive blood cultures for bacteria that commonly cause infective endocarditis, evidence of infection on a heart valve, as seen on imaging studies such as echocardiography, and the presence of a new heart murmur. These criteria are considered key indicators of a high likelihood of infective endocarditis. The minor criteria include fever, predisposing heart conditions such as valve abnormalities, embolic phenomena, evidence of small blood clots traveling through the bloodstream, immunologic phenomena, such as the presence of certain antibodies in the blood, and microbiologic evidence of infection, such as positive blood cultures that may not meet the criteria for a major criterion. Treatment for endocarditis typically involves a combination of antibiotics to target the specific bacteria causing the infection. In more severe cases, surgery may be necessary to repair or replace damaged heart valves. In conclusion, Infectious bacterial endocarditis is a serious condition that requires timely and appropriate treatment to prevent further damage to the heart.
Thank you for your attention, and I hope you have gained valuable insight into this important topic.